Well, thanks, Rich. And I think it's wonderful you're having this subject covered. You know, it's a extremely important question how therapists can use not only neuroscience but all the branches of science as a foundation for their work. And so I think it's great that you're doing this. So thank you. You know, in the assessment phase, what's really crucial is to realize that a psychotherapist, someone who is a therapist in the field of mental health, is actually assessing the mind. And the mind is not the same as the brain. So while we're going to look at neuroscience, it would be really, I think, a serious mistake to think that a psychotherapist is a brain therapist,
Uh-huh.
because we are not neurologists. Neurologists are wonderful people doing important work, but we are people in the field of psychotherapy, of mental health, not brain health. So in the assessment phase, this first part you're asking that we talk about, it's really important that a therapist realize that as a member of the field of mental health, we have these two words, mental and health. And so from the perspective that I and my colleagues work from, called interpersonal neurobiology, we see the mind as this process that's both embodied, so it's more than just what's up in the head and the brain, but it's the whole body. And we also see it as not just embodied, but it's also relational. So, you know, the experience that we have in the assessment phase is going to be fundamentally exploring the mind, because as a mental health practitioner, you will be actually looking at the relational experience that emerges and trying to tease apart different aspects of the embodied experience, all within the framework of the subjective life of the client, of the patient, which means their inner felt sense. It means the kind of thinking they have. It means their mood. It means their attitude, their hopes, their dreams, their longings, their intentions. All of that subjective inner mental stuff is the essence of what we look for.